The state of Idaho announced yesterday that their hospitals in the northern part of the state are so overwhelmed with COVID-19 patients that they have now made the harsh decision, the horrible decision, but it's the decision they had to make, to ration care in their hospitals, in their medical system. They're going to ration their care. They don't have the space for the amount of people that are coming in, and they don't have the staff to tend to everyone. They don't have the equipment, the life-saving equipment to treat all these people. So what they're going to have to do is make a snap judgment when people come in. Is this person likely to survive if we give them the best treatment? If the answer is yes, you have a good chance, not a guarantee, but a good chance of getting put in an actual hospital room with ventilators and all the other life-saving equipment. But if they do not believe, due to comorbidities, age, whatever it is, if they don't believe you're likely to survive even with the best care, they're going to have to put you in a bed in a conference room where they don't have all of the equipment. They still promise to give you the best care possible, but they're essentially having to put you in a separate room to fight it on your own or succumb. That's what's happening in Idaho, like the whole freaking state. Their Department of Health and Welfare had to come out and make this announcement. Okay, this isn't like one or two hospitals. It's not just the northern part of the state. This is statewide, although the problem is worse in the north. And Idaho is not unique here. They're unique in the fact that obviously this is the first time a state government has had to come out and say, listen, we got to put in death panels to decide if you're going to live or die, if you're going to get the good equipment, or if we're putting you in a conference room in a bed to see how you do there, because we simply cannot handle it anymore. Now, Idaho ranks 42nd in the country in total vaccination rate, so not doing super great already. The governor had to come out and beg people to get vaccinated, to protect themselves from this virus. But at this point, even if people start running out today, or actually yesterday when they made the announcement, and get vaccinated, you're still a good, 6 to 8 weeks out from those people being, fully protected as much as possible. And again, it won't even stop them from getting sick from it. It just reduces the likelihood that they're going to have to be put in a hospital because of it. But that would still be 6 to 8 weeks out before they have that full protection. And the hospitals are at capacity now, today. People will die because of this decision, and the hospital understands people are going to die because of this decision, but it's a decision that they had to make. And at this point, we have to kind of look introspectively and wonder if these hospitals, should they keep treating unvaccinated people? People say it's my body, my choice. Okay. But the bodies of those medical workers who are already stretched thin, they're the ones that have to come to your aid. So no, it's not just your body, your choice. The cardiac patient that cannot get into that hospital now, your decision to not get that vaccine could be a death sentence for somebody else that has nothing to do with them getting COVID. Not to mention the people that you could potentially spread COVID to, that you could kill that way. It's not my body, my choice. This is a choice by individuals that impacts the health of everyone around them, even people that aren't around them. In the case of hospitals, have to turn away other emergency cases because they don't have the ability to treat them. Imagine that. Imagine having an appendix that's about to rupture. You go to the emergency room. You can't get that emergency life-saving surgery because of all these people who made their independent choice to not get vaccinated. I do want hospitals, by the way, to continue to treat unvaccinated people. I think everybody deserves this. But we are going to start seeing more states have to make these decisions. What do? How do we handle the caseload? How do we handle the other emergencies that we currently can't get to because of the unvaccinated folks? When you make selfish decisions, you impact the lives of everyone else. And that's a harsh lesson to learn, and I don't think people have to die to learn that lesson. But it's not up to me, because I'm not a doctor, and I don't run a hospital. And those are the people having to make those life or death choices today across the country. And it's only a matter of time before they say, to hell with this. Because actually, you know what? It's not even a matter of time. We have already seen doctors in this country say, I'm not treating unvaccinated people anymore. So I don't even know what I'm saying when I say it's a matter of time. It's happening already now. And it's going to keep happening. And more people are going to die because of these selfish and stupid decisions based on misinformation from bad faith actors across the country.